When it comes to healthcare in Massachusetts, the cost is fairly high, but so is the level of patient satisfaction. However, patients do have concerns about cost and access, and those concerns are reflected in the annual surveys by the Mass Medical Society. To tell us about the survey released a few weeks ago is our guest from the Society, the President, Dr. Richard Aghababian. Thank you very much for being with us, Doctor.
Thank you, Chris, for inviting me.
Let's start with the single most noticeable trend over the last 8 years or so, and it says that the access to care is less difficult than it used to be. What's going on?
I think physicians have geared up to fill their practices. We have in some parts of Massachusetts training programs going on, and I think physicians like to stay in some cases where in the area they trained in. Apparently we're doing pretty well. There are pockets though where there are inadequate physicians to cover the population.
There are parts of Massachusetts, far from Boston maybe, where it looks pretty difficult. Why is it so much better in Boston?
I think there are probably more patients to see, and practices get filled up more quickly. There may be some economic disincentives to practice in rural areas. Having a private practice office is difficult these days because of all the new requirements for computers and equipment, and if the majority of your patients are on public insurance, and the amount you take in may not be sufficient to cover all your expenses. So there are some disincentives in terms of access to plenty of patients, and some disincentives to financial needs of the physician.
Well, you have this organizational infrastructure in Boston. You have the hospitals, including these very prestigious teaching hospitals. They're connected to community health centers, and a number of those health centers have been renovated and expanded and upgraded. So I guess that all really makes a difference.
Oh, it really does. And you have 3 major medical schools, nationally recognized medical schools here in Massachusetts, who are eager to have their residents and fellows train there, but when the residents and fellows are there, they're also attending physicians to supervise them. So you have a very nice infrastructure here in Boston.
Not surprisingly, your survey shows that it's still easier to get access to a specialist than to a primary care physician, but there has been some change in that kind of access to primary care. What do you see from these surveys?
As far as access to primary care, it's slightly easier to find a physician now than it was a few years ago. And despite the fact we went with universal coverage, or near so, I think we're about 98.5%, people aren't waiting any longer now than they were before, so that's a good sign. The medical infrastructure has risen to the occasion, and we are providing care. We are probably better at using paraprofessionals, allied health professionals to help us take care of patients too.
There is, I guess, a little bit more difficulty in getting some of these primary care physicians than others, and I was particularly struck by, I guess, the lower rate of acceptance for Medicare or Mass Health among internists. Is it that?
Well, it's still about 90% for Medicare and a little bit less for...
I mean Medicaid, rather.
Medicaid, right, you said Medicare. Medicaid is a little bit less because the reimbursement rate is about 60% of what you would get for a private insurer. Remember, the survey was of people primarily in private practice. Well, with all the requirements now put on physicians for prior approval, for implementation of computer systems, the expenses of being in private practice are mounting, and the reimbursement is probably going down a little. So I think there are physicians having trouble meeting all their expenses in their offices.
What about some of the insurance options out there? Because this survey, you asked patients their thoughts about that.
There are a lot of options. Overall, people seem to be satisfied. I mean, 90% said they were satisfied with their care. I assume their care included the cost of it in that question.
I found that there were some concerns about insurance plans, that limited choices to a well-defined network, and I guess there might be some misgivings even about global payments among people.
I have heard that there are people who sign up for an insurance plan recommended by their employer, take the cheapest plan, only then to recognize it's a limited network, or that the copay is much higher, or they reach the cap. Their contributions will have to be more. So I think part of it is people didn't read all the options carefully and then found themselves having selected an option that wasn't as good as what they had before. They have to wait for the enrollment period before they can change options.
What do you take as a lesson? Because when people look down the line, they mention more competition for insurance, and yet it always seems to come down to the one with the higher co-payments is cheaper as far as premiums. So it looks like it's just very hard to find a bargain out there.
It's hard to find a bargain, but I think you have to look around. There is more competition now than there has been in the past, and insurers are offering a wide variety of options. So I think you have to study the options, consider how many people you're covering when you sign on, your family size, and how much risk you're willing to take as far as catastrophic expenses if you have an unfortunate situation, or the payment of for drugs, for pharmaceutical agents.
You talk about studying the options. There is more information out there. More of the people in the survey seem to know what's out there, but maybe they're not as eager to study that information.
Well, I think I think that's true, and I don't know that it's an unwillingness. Things have changed so quickly since 2006 in Massachusetts that we were accustomed to having a plan that you stayed with for a long time and probably wouldn't change unless you changed, or someone in the breadwinner in the family changed jobs. And now you have to look, because even within one insured, plans change quite a bit from year to year. So I think people have to get used to really studying their options when they have an opportunity to make a change.
Thank you very much for being with us.
Thank you.
Dr. Richard Aghababian from the Mass Medical Society.